बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is male, almost 30 year age, with history of pain in the left renal area, referred to the pelvic region. So I am going to scan the left kidney. Today we will try to locate the ureter. So as we know that ureter is a muscular tube. It is a tube passage that has three layers. The inner one is the mucosa, then is the muscle layer, and then is the adventitia. So it is a tube, muscular layer, and these muscles are made up of smooth muscle fibers. So first we are going to scan the left kidney, ask the patient to adopt the decubitus position so that we can see the kidney. Here now we can appreciate that left kidney, and this is the renal sinus first, and this is the renal pelvis. And from the pelvis, at its medial aspect, the ureter extends from the renal pelvis to the urinary bladder. So first we should locate the left kidney and renal pelvis. When we have located the renal pelvis, then we should at the same position in the decubitus position, just drag the probe to see the pelvic-ureteric junction. Drag the probe only for a few millimeters, and sometimes we can also appreciate the PUJ in the same location as we are looking the kidney. So this is the renal pelvis, and this is the ureter coming outward from the kidney. So it is located at the medial aspect of the kidney, and then it passes downward. So it has, we can say that it has four parts. Number one part which is the pelvic-ureteric junction, PUJ. This is the one part. So when the renal pelvis ends and it takes a slight turn, this is the portion where the pelvic-ureteric PUJ is present. So we should locate the PUJ. When we can appreciate the PUJ and no stone is found, and then we should locate the remaining ureter. That is the proximal ureter, we can say. So we have discovered that it has four parts. Number one, PUJ part. Number two is the upper abdomen part, or we can say it proximal ureter. So when we have seen the PUJ, then we should locate the ureter at the proximal ureter. So we can everyone should know that sometime if there is no urine present within the ureter, so ureter cannot be traced, cannot be visualized, because it is collapsed. So for this reason we are unable to find the ureter, as it is collapse. So now turn the patient in spine position and then place the probe at the left flank region. When we place the probe at this location, just find this muscle. This is the psoas major muscle. The proximal ureter, upper ureter, it passes anterior to the psoas major muscle. From the PUJ downward up to the pelvic brim or up to the crossing point of iliac vessels. So when we have seen the muscle, this psoas major muscle, then just angle or tilt the probe toward the right shoulder or angle it slightly upward. So I am gradually maintain the probe pressure so that baba loops, gases or baba loops should be displaced. So I am now gradually tilting the probe just upward. When we do such maneuver, we can appreciate the linear black structures. This one is the linear black structure, this is the linear, this is the linear. So these are the tubular structure. This is the ureter which is passing anterior to the psoas major muscle, and this is the iliac vessels. So at the same position, just tilt the probe toward the right shoulder, just angle it upward, then the muscle will slightly disappear and we will see the urine filled ureter. If it is mildly filled with the filled the urine, then we can easily appreciate. If the patient is fatty, bulky, we should use the low frequency probe, and if the patient is thin, we can use the high frequency probe. So if we are unable to recognize whether it is vessel or ureter, we can apply the color. This is the psoas major muscle, then I am tilting up slightly, anteriorly angling it, and then I will see the, look at here, this is the vessels and this is the ureter which is not taking color. Then when you have find the ureter, then drag it while the focusing the ureter in the screen and drag it downward up to the pelvic plane or crossing point of iliac vessels. So here we can appreciate these are the vessels and this is the ureter which is crossing the iliac vessels. So it is the area where the stone can be trapped, as it is a narrow constriction physiological while the ureter crosses it. So 2 points we have seen. Number one, PUJ, where there is a physiological narrowing, and other is the crossing point of iliac vessels where there is a physiological narrowing. So in these points, both in these 2 points the stone can be trapped here. So when we have reached the area where it crosses the iliac vessels, look here, These are the iliac vessels, and this is the thin tube it is crossing. When it crosses the iliac vessel, then we reaches the pelvic region. In the pelvic region, small bowel is present and which is full of gases, so there may be difficulty to stress the ureter until it is significantly dilated. So then go to the pelvic region while the probe is in transverse position. Initially probe was in longitudinal position. Now just put the probe at the pelvic region to scan the urinary bladder, and then try to locate the VUJ, vesico-ureteric junction. This is the look here. This is the ureter entering into the urinary bladder. This is the right one and this is the left one. So when we reach the vesico-ureteric junction, this ureter, it passes through the wall of the urinary bladder and then enter into the urinary bladder. This is the trigone area, and here ureter take a oblique turn. So this is called the intramural part of the ureter. Means it is present within the wall of the ureter, and this is the main portion where there is a flap wall mechanism that prevent the urine to reflux into the kidney until this mechanism is failed. And here, as we know that this is a ureter having smooth muscles, so there are two layers in the upper two-third of the smooth muscles. One is longitudinal, inner one, and then outer one layer is the circular. And when it reaches the lower two-third, it has three layers. An extra layer is present. Inner one is the longitudinal, then middle one is the circular, and then outer one is the again longitudinal. So why three layers? Allah has provided a three layer because here it needs strong peristalsis, strong contraction, because there is a high pressure when the bladder is filled. So there is a high pressure from the bladder to the ureter in this portion. So to compensate, to overcome this pressure, this ureter has to maintain its strong contraction to propel the urine into the urinary bladder against the strong pressure of the urinary bladder. Due to this, nature has provided the extra layer so that this is the most narrowest part of the ureter when it is passing through the wall of the urinary bladder. This intramural part is narrowest part of the ureter. So for this reason, mostly this place, this is the place where the stone can be trapped. So now we have reached the urinary bladder and look at the this is the ureter. You can see that This is to some extent dilated as compared to the right side. So give a pressure here so that we can see whether stone is here or not. You can use the both hands so that we can appreciate. So here we can appreciate this one echogenic area. I'm going to show you. This one. This is the echogenic area at the vesico-ureteric junction, and this is the stone. This one. This is the small stone. We can appreciate this one, which is trapped at the vesico-ureteric junction, which is the narrowest part of the distal ureter. Again, I am going to show you because I am using both hands here. If we closely observe, we can see that the bladder is not optimally filled. So it should be filled optimally, significant filling, not over distended. Then you can easily find the this is the stone. I cannot point with the arrow because I am using the both hand, and this is the stone. This one echogenic we can again I am going to show you. This one is a small stone, hardly visible. We can use the color so that we can have any twinkle artifact. Look here, twinkle artifact. So small stone may not give posterior shadowing when use the color to see the twinkle artifacts. So this is another thing we should see we can see the ureteric jet while using the color. It will also show whether there is a obstruction, partial, complete, to either VUJ region. Look at here the ureteric jet. Again we can see this is the stone. So this ureter is almost 25 to 30 centimeter long, and it is a muscular tube. It is, we should know that there is no passive transport of the urine from the kidney to the unibladder, rather it is an active transport. So active transport means the muscle muscle layer of the ureter contract, then it propel the urine from the renal pelvis to the urinary bladder. So this was all about the ureter, how to trace it, and we can also see that why there is a colicky pain. This is due to the hard, strong and aggressive contraction of the smooth muscle of ureter against the obstruction. When the stone is obstructing the urine, so to propel the urine, this smooth muscle has a strong aggressive contraction to propel the urine from the obstructive portion toward the urinary bladder, due to which the patient feel colicky pain due to this strong aggressive contraction of the smooth muscle. So thank you very much. This was how to trace the ureter from the. This was the left-sided ureter. When I will come across of the right side, then I will tell you how to trace the right ureter. Thank you very much.